You're watching Fox 45 Morning News. All local, all morning.
The ultimate acid trip. Dr. Geeta Shah will join us in the studio to tell us all about the chemical peels and why they're so popular right now. 8:12, you're watching Fox 45 Morning News, all local, all morning. This morning's Makeover Monday is the ultimate acid trip. Chemical peels are at an all-time high, with more than 600,000 of them performed last year. That's up 40% from the previous year. Dr. Geeta Shah is a board-certified dermatologist from Capital Laser and Skincare in Chevy Chase, and she's here to explain why they're so popular. Good morning.
Good morning.
All right, so first of all, what is it? When we talk about an acid peel, what's going on there?
So basically, a chemical peel is applying a little bit of a light acid to the skin.
Okay.
What happens is it helps to break the superficial bonds in the skin and causes some exfoliation. So what this does is it helps to normalize cell turnover, helps to stimulate collagen production. These are all good things for the skin. It helps with the aging process, helps with acne, can help with sensitive skin issues, and can also help with pigmentation.
And so that's obviously deeper than what you can do with just regular exfoliation that we're supposed to do all the time.
Exactly.
How often do you get that done, or how often should you get that done?
So it depends on the indication that we're trying to treat. Generally, we recommend treatments once a month.
Okay.
If you have certain conditions like acne, you can get it as frequently as every 2 weeks or so. Pigmentation, sometimes we can treat more frequently, like every 3 weeks, but generally a rule of thumb is about every month.
All right, we have some pictures because I'm curious to see the before and after and what people can really expect when they go to do these. So can we bring up the first picture? Now, in this, what are we seeing here?
So basically, this is the Ultra Peel, and this is helping with fine lines and aging skin.
Oh, that's
so
good. That's a good one, too.
No, it's a very popular peel.
Okay, and then this next picture does what now? And we're going to see in the next half hour, we're going to actually see you go through this. But this one,
so this
huge
is,
difference.
Right. This is helping with people that have sensitive skin or rosacea issues. There's a misconception that people with sensitive skin cannot use peels, but clearly, if we use the right type of peel, you can get a really good result. Okay,
let's see the next picture.
So this is one of the deeper peels, which is going to help with pigmentation. So you can see a nice difference in the brown spots, the discoloration before and after.
How long does this take, usually, or does it vary depending on which peel you get?
It depends, based on the peel. So sometimes peeling can last for a few days, and sometimes it can be longer, like a week, up to 2 weeks.
All right, and what is this one we're seeing?
So this is another peel which is designed for pigmentation. So it's helping to reduce discoloration, uneven skin tone, and brown spots.
Is this only for the face, or do you do these peels on different parts of the body?
Generally, the most popular area that we treat is the face, but we can use it on hands, chest, neck, other body areas.
All right, well, coming up in our next half hour, Dr. Shah is going to show us how to do it so we can see exactly what's involved. So you definitely want to stick around and see that. Thank you so much.
Thank you.
We'll see you again in just a little bit.
This morning's Makeover Monday, though, will give you the ultimate acid trip coming up. You'll get to see Dr. Shah perform a chemical peel, and the results from that procedure will show to you all. 8:51 is the time. You're watching Fox 45 Morning News, all local, all morning. 8:54, and for your Makeover Monday, we are back with Dr. Geeta Shah, and she is joining us for the Makeover Monday, and we're calling this the ultimate acid trip. In fact, as we speak right now, they just started applying the acid or the chemical peel for our model here, and we're going to see some of the results from patients. And Dr. Shah, as soon as I came over here, I said, this sounds painful.
Right, so that's a common misconception. Chemical peels are not a painful process.
Okay.
So generally, when we're applying the peel, you might feel a little bit of burning, tingling, that type of thing, but it should not be a painful process, and it does not involve a lot of downtime.
Burning, tingling, what do you mean by that? Just by putting on, say, like a stronger soap, you know, where you kind of put on those more cleaning soaps and they tingle on your face? Is that about what we're talking about?
Yeah, that's about it. And generally on a scale of 1 to 10, it's about maybe a 2 to 3. Maximum of 5.
Okay, all right. And now the process, though, because I know that you did do a couple steps just so we could watch the actual peel brushes, the chemical application now. What did you do beforehand to her face right when we were in commercial break?
So before we started the actual peel, we wanted to cleanse the skin and use a little toner to get all the greases off.
Okay.
So now we're at the peel stage where we're applying a thin layer of the peel. We can do one layer, we can do multiple layers, just depending on the indication and the condition of the skin.
That's a great question right there. Depending on the layers, how long does it take to apply one layer and then you wait? Do you peel that off and then do another, or do you just keep applying?
No, we wait. So we apply one on top of the other.
Say if we were just going to do our first initial one-layer peel to take off just the light, I guess it goes more depth, the deeper, the more layers you put on?
Correct.
How long would that take for your office then, if we're an office visit? How long should we plan?
So generally the peel takes about 15 minutes or so.
Okay.
After we actually perform the peel, we will finish up with some skincare products. So in particular, we're going to put the Rebalance on, which is going to calm the skin, help reduce some of the tingling, the burning sensation, which again should be mild. And then most importantly, we're going to put SPF on.
Okay.
So definitely after the peel, it's important to protect your skin from the sun. And then during the peeling process, that new skin is also very sensitive to the sun. So we need to make sure that the sunscreen is placed.
So planning for that, patients should know, okay, I try to avoid the sun before and after the peel process. Now, when you just put this on, you gently put it on, took less than a minute, and her face, I'm seeing a little bit of redness, but not much at all.
Yeah, this is pretty much all that we need to do. And then we'll wait just a couple of minutes and put a little bit of the Rebalance on to help calm the skin.
Pain, so we talked about the pain, hardly any pain whatsoever at all, a little bit, but what about the peeling process and afterwards then? Does your skin start peeling like you had a bad sunburn?
So generally the peeling starts within about 2 to 5 days of the peel and can last usually up to 7 to 10 days. There are some more heavy peels which can cause a little bit longer peeling, but generally we say expect peeling at about day 2 and expect it to be done by day 7. And by peeling, I don't mean heavy sheets of skin coming off. It's just light exfoliation, really dry skin.
And that's when we'll see the results? Do you see the results like a week afterwards then?
You'll start to see some of the results within a week's time. Generally, the best results are within 2 weeks.
If you went in for one session, had a one done, you wanted to try it out, how long do you have to wait then to go back in afterwards? Is it just 1 week after it's finished peeling you can go back?
Well, we want to wait a little bit more time, so we usually recommend doing peels once a month.
Okay.
And especially if you're on a good daily regimen, it's important to add superficial chemical peels to your maintenance for really good results. Really best outcomes that way.
Last question I have for you, doctor, as you're finishing here with this model who's been handling. What about any kind of medications? Is that important to know about if anybody's on medications that may interact with skin?
Right. There are certain topical medications that we want to stop before we do chemical peels. So anything that might have a little bit of mild acid, or especially a retin A or vitamin A type derivative. So that's important to stop before a peel.
All right. Well, there you go. Easy, and you seem to be doing quite fine. You were closing your eyes. You said you even fall asleep sometimes. It's so relaxing for you.
It is.
There you go.
Amazing.
So no pain whatsoever. All right, thank you so much. We appreciate your time coming in.
Okay, thank you.
Dr. Geeta.